This is Self-Care Part 3, and the focus of this section will be on toothbrushes and different types of toothbrushing methods. So basically, the characteristic of a toothbrush, it should conform to the patient, whatever their special issues may be. It needs to be easily manipulated, something that can be readily cleaned, and it should be fairly flexible, soft, and the handle fairly light. They should be durable, although they don't last forever. A lot of times people tend to keep their toothbrushes longer than they should. As soon as the bristles start to fray, you need to throw it out. And toothbrushes are fairly inexpensive. And the filaments should be end rounded. And basically they should be able to keep clean. So there are 3 different basic parts of the toothbrush. You have the handle, obviously, and then the shank, almost like an instrument, and then the head or the bristles of the toothbrush. So basically, all different types of companies make all different types of toothbrushes. There's many out there, but it's basically one of the most important issues is whether the patient likes it or not. You can recommend a certain type of toothbrush, but if the patient hates it, it's not going to go over well. So basically, patient preference is huge. Okay. Basically, there are different types of shapes of bristles, and you may want to help your patient with recommending the profile of the bristles and what may be best for the patient. There are some larger diameter handles which may be better if your patient has any kind of dexterity issues, and it's certainly easier for younger patients as well to have a large diameter. You can also rig up toothbrushes with different types of handles and things like that to make it easier for patients. Toothbrushes are generally have nylon filaments. There are some natural bristles, which tend to be not as good and not recommended. And the diameter and length of the bristles are all different, and many different manufacturers will make soft, medium, and hard different types of bristles, but we never recommend medium or hard bristles. So you always want to make sure that one of your main recommendations to your patient is that they use soft bristles. Okay. And I had said earlier about end rounding. This is basically the way they treat the bristles, that they're sealed and rounded, and it makes it less likely to cause gingival abrasion if the bristles are end rounded, and most of them are these days. So here's the different types of profiles. The very traditional flat, and then the more rippled approach, which can be a little bit better for reaching interproximal areas, and then the dome-shaped, multi-level, and angled, and then the bi-level orthodontic one on the bottom is obviously for patients with braces. So the toothbrush selection, like I said, it's really going to depend on patient preferences. That's first and foremost. You want to think about the gingival condition that the patient has, the position of the teeth, whether they're malposed or what the occlusion is like, the shape of the teeth, and if recession is present is going to depend a lot. The patient compliance. And another important aspect is going to be the type of method, toothbrushing method that you recommend to the patient, or the type that the patient uses. So when you are going over toothbrushing with your patient, you want, first and foremost, you have to figure out exactly what they're currently doing, have them show you so you can figure it out. You want to make sure that you've covered the sequencing, because a lot of times people, will maybe brush one area really good but not the other. So you want to focus on sequencing where your patient starts and where they end. Okay, and typically you want to recommend them to start in the worst area, because they're always going to be top notch at the beginning of brushing and then may lose focus towards the end. So you want to make sure that they have a sequence and some kind of timing system, whether it's a count system, they use a clock, or many times for children you use those egg timers. Um, and then many electric toothbrushes have timers already built in. So make sure that there's a system for timing. You also want to address frequency. Ideally, twice a day is ideal in the beginning of the day and at the end of the day, and of course, after meals. But it's really going to depend on the patient's risk factors, their disease status, and those kinds of things. Okay, and then of course you want to make sure that the right toothbrushing method has been recommended for the patient. So there are many different types of toothbrushing methods, so you're going to have to figure out what your patient is doing and make sure that it's ideal for them. So we'll go through a couple of the different types of methods, and then of course in clinic it's going to be a little bit easier. We can make sure that you're showing us or we're showing you how it's done. Okay, but just to describe it a little bit, the BAST method is probably the most technically challenging method. It's also called the SULCULAR brushing, and this is indicated for perio patients. So this is basically if a patient has high dexterity in a perio condition, this may be ideal. So this is when patients have biofilm adjacent to the gingival margin or beneath the gingival margin, or open embrasures or recession. Okay, patients who have had perio surgery and or Pontics or abutments or ortho. Okay, you want to be very careful when you're recommending this to patients that are aggressive brushers. They can easily cause trauma with this. Okay, so the way the brush is directed basically at a 45-degree angle towards the apices of the teeth, and it's directed 45 degrees, and the filaments are actually inserted subgingivally. Okay, the brush should be pressed lightly, and that you're making sure that the filaments are under the sulcus and cover the margin. Okay, you want to vibrate the brush back and forth, really gentle and very lightly, and then count to 10. You then reposition to the next tooth, or next one or two teeth, depending on the size of the length of the bristles. You want to make sure that you overlap and you repeat the stroke for each section. Okay, and you hold the brush the long, narrow way for the interiors. So the next method is the rolling stroke, and this is basically when you want to clean the gingiva and the teeth without emphasis on the sulcus, so maybe not necessarily a periodontal problem. This is ideal for children that are relatively healthy, and it's obviously not for really young children, but it can be a step up once their dexterity improves. It can be used in conjunction with other types of toothbrushing methods. Excuse me. And basically, you're going to put the plastic portion of the toothbrush adjacent to the occlusals of the teeth. Okay, so you're positioning with the bristles straight up. Then you're going to slightly rotate the bristles on the gingiva and the tooth. Okay. You're going to roll the brush slowly over the teeth, okay, and you're going to repeat that 5 times. And then again, you use the long, narrow section for the interiors. So some of the problems is people place the brush too high and they may lacerate the mucosa, and there is a tendency to miss the cervical third. So the modified STILLMAN is basically when you're trying to remove biofilm on the cervical 1/3, and it's incorporating a rolling stroke with the vibratory phase. Okay, so basically it's that roll stroke plus a vibration. So you're going to direct the filaments apically and place the side of the brush on the attached gingiva. So the placement is just like the other one. And then you're going to press and flex the filaments against the gingiva. Angle the filaments at a 45-degree angle with the long axis of the tooth, and you're going to activate a slight rotary or vibratory motion while maintaining light pressure. Then you count to 10, and then you continue with the roll and vibrate the brush, and then you finish off the whole tooth. And then you repeat 5 times and then reposition. Okay? You want to make sure that, again, you have end-rounded filaments and that the pressure is light. Okay, so patients may try to move the brush into the rolling stroke too quickly and miss that vibratory action on the cervical third. So this is just showing you the Stillman. Then there's the Charters method. This is ideal for patients. Basically, we only recommend this really for ortho, or if someone has had surgery on the gingival tissues and you're trying to avoid the tissues. This is primarily for ortho, and basically you want to direct the bristles the opposite way, 45 degrees to the occlusal table as opposed to the apices. So you flip the toothbrush back down, aiming towards the occlusals, and use a vibrating motion, and then you reposition the tooth and overlap. Okay. So this is just showing you the angle for the Charters. And then phones, or the circular motion, this is just really for children and young children. So the teeth are closed and you used a wide circular motion, and a circular motion with very light pressure. Okay, so the problem is many times this is fine when you're young, but people don't progress and adapt as they get older and more dexterity. So you have to make sure that you transition people into an evolving toothbrush method. Then there's occlusal brushing that's usually always needed in addition to the other types of toothbrushing methods, just to make sure that all biofilm is removed from the occlusals. So basically, place the brush on the occlusal surfaces of the molar teeth with the filaments pointed into the occlusal pits at a right angle, and you position the handle parallel with the occlusal surface. So you vibrate the brush in a slight circular movement while maintaining the filament tips on the occlusal surface throughout for a count of 10 while pressing moderately. And you reposition, repeat about 10 times. So then some other toothbrushing methods, which you'll see very frequently, but they're not really recommended and they're detrimental. So one is the horizontal method, and this is we basically do the horizontal scrub, just brush sideways, and it can produce abrasion. And the same thing with the scrub brush method. It's basically all over the place, and erratic, horizontal, vertical, circular, kind of all over the place. And this can encourage recession and abrasion as well. So the next thing that I want to talk about is power brushes. So basically, power brushes have changed a lot. Years ago when I was in hygiene school, basically electric toothbrushes were only recommended if a patient had a dexterity problem, a disability, for young children, that kind of a thing. And now they've really evolved, and they're really so good that they're really pretty much always recommended. And there are those other situations are when they're highly recommended. Okay, so even somebody who has good oral hygiene can still improve when they have an electric toothbrush. Okay, there's all different types and shapes and techniques, and basically most of the research says that they're all pretty good. There generally isn't one that seems to stand out that's always spectacular. So it's probably going to be really based on preference for your patient. Okay. So really indicated for all patients. When you want to highly recommend a patient for power brush is if they have poor home care or ineffective, periodontal conditions, especially if they're not responding, patients with dexterity problems or physical disabilities, if a patient has a lot of stain or ortho or implants, complex restorative or prosthetic treatment. Aggressive brushers actually do a lot better because you can't overdo usually with most of the electric toothbrushes. Um, oh, I repeated that. Patients with disabilities. For caregivers, it can be very helpful for someone who's trying to brush somebody else's teeth. It's a lot easier. In the mechanism of action, some work on rotational, some are counter rotational, some are oscillating, and some are sonic. And here are the different types of profiles and different types of brushes that are found. So basically, even though a patient's using an electric toothbrush, you still want to make sure they know how to use it correctly. And probably the easiest way is to tell them, instruct them to bring their electric toothbrush in so that they can demonstrate in their mouth how to use it and you can make any suggestions or modifications. But again, it's really hard if you don't demonstrate or have them show you. It's really hard to know exactly what they're doing. Okay, so make sure to do that. Um, so basically, how you use an electric toothbrush is you put a small amount of dentifrice or toothpaste on the toothbrush and you spread it over the teeth. Placing the toothbrush in the mouth before turning it on can prevent all the splashing and making a mess. You brush each tooth and the surrounding gingiva separately, and you're turning the brush to try and access the proximal area. And you always want to try and angulate the brush to accommodate rotated or crowded teeth. And you're just using light and steady pressure. So one of the biggest problems is people tend to like zip right around with an electric toothbrush. So having them stay in the area long enough for the electric toothbrush to do its thing is usually what you have to focus on. So then there's supplemental brushing that's really going to be specialized for each patient. It may depend on an area of crowding they have or an area that's hard for them to reach. So you can always help them. Some areas that tend to get in trouble are teeth that are displaced facially. So if they're tipped facially, they may get overbrushed, whereas a tooth that's lingual will be missed. Okay, inclined teeth can also be a little more difficult. Exposed root surfaces are a little more work to keep clean. Furcation areas are tough. And in general, right-handers tend to miss the right corners. They tend to brush for the posteriors and then flip the toothbrush and access the anteriors, so they kind of miss those corners. So many times for right-handers, they miss the right corner, and lefties, they miss the left corner. And a lot of times people will miss the distals of the last tooth in the mouth. So sometimes you may recommend using the brush in a vertical approach for those teeth that are malposed and inclined. And then you want to make sure and show them how to angle the brush like this if they're missing the distal of the last tooth. And then there's tongue brushing. So you want to make sure that your patient knows to do that. It's going to remove a lot of the bacteria for your patient, and you can use it with either a tongue brush cleaner that's specifically for that, or just use a regular toothbrush. So basically you put the brush at the back of the tongue and brush forward, okay, with light pressure, and you repeat. And you want to make sure that the patient knows to do that. And some people gag, some people can't do it, so maybe just have them go back as far as they can until they're comfortable without gagging themselves. Basically going over there. So there's a tongue cleaner. So When it comes to toothbrushing, there can be some ill effects, and that's basically when a patient does it wrong or too aggressive or chooses a brush that's too abrasive and the bristles are too hard. So you want to make sure that they're aware of that. You can get these lacerations or ulcerations, a scuffing of the gingiva. You'll have little red spots, and it can cause recession as well. So you want to make sure that you've made the appropriate recommendations for your patients so they can avoid that. So here's an example of toothbrush trauma, and it's generalized and it's everywhere. So you'd want to make sure and explain that, point it out to your patient, help them figure out what's causing it. Now, when you do toothbrush, you actually create a bacteremia. Okay. Now, definitely the incidence and magnitude of a bacteremia after scaling is always significantly better, is higher in patients with perio, okay, than healthier patients. There's no definitive data on the relative risks of using manual or electric toothbrushes in patients who are predisposed to an infective endocarditis. So it's probably just best to make sure that they check in with their cardiologist. If they are at risk, make sure that it's okay. But the fact that bacterial endocarditis can be produced through toothbrushing makes the need for maintaining proper oral hygiene a priority. So definitely if someone is at risk, the better oral hygiene, the better.